The family of a woman who took her own life more than 50 years after she was sexually abused as a child says more needs to be done to help adult survivors. Vivian Call's life was marred by relationship problems, mental illness and addiction. But her sister believes she would still be here if she'd received the right care. Ursula Malone has this report.
It's her on a swing.
Yes. 2 months ago, Fiona and Ethel Robson lost their much-loved sister and daughter Vivian to suicide.
The three of us is in our moo-moos.
The family album brings back memories, not all of them happy.
We didn't speak about it until our 30s. We were in our 30s. But as very young children, we were sexually abused. And we kept it secret.
Their abuser was a trusted relative. Vivian struggled with mental illness for decades.
She was a trauma survivor, struggling to get help. But no one was recognising the trauma.
Dr. Cathy Kezelman co-wrote the guidelines for the treatment of survivors suffering complex trauma, guidelines that are now used in countries around the world.
It can have very profound effects because it happens during those very crucial developmental years when the brain is growing most rapidly. And sadly, when people don't get the right support, it can affect people right into old age.
She says mental health professionals need specialist training to recognise this kind of complex trauma.
We know that people can recover. They can feel fulfilled, can have really positive lives.
See, she looks happy there.
Vivian Call's family believe she'd still be alive today if she'd received the right care.
She could have been wonderful if she'd had a proper life. She could have done anything, and she would have been so good at it.
A life cut short, but not forgotten. Ursula Malone, ABC News.
And all week, the ABC is promoting awareness of mental health. If you're struggling with mental illness or you know someone who is, there's a full list of support services on our website. You can also contact Lifeline or Kids Helpline.